Hi, my name is Dr. Pat DiGiacomo, and I'm the chair of the undergrad nursing program at LaSalle University.
Hi, my name is Heather Conville, and I'm the academic advisor in the School of Nursing and Health Sciences.
We are here to go over our nursing program at LaSalle University, but before I get started, we want you to know that we are thinking of everyone at this time, this difficult time. We hope your family and your friends and you are healthy. And this is why we are doing the virtual versus an in-person session. So I want to welcome you again to the LaSalle University and for us to discuss the BSN program. We're going to discuss what makes a successful nursing student, and we'll go over our curriculum. Why do you want to choose LaSalle University? We have experienced, caring, and dedicated faculty and staff. Students are admitted to nursing freshman year, and that is an important piece when you're looking at different programs. You want to make sure that you're admitted to nursing freshman year, and then you're able to concentrate on the nursing program and you meet your cohort starting freshman year. Tutoring is available starting freshman year, and there's so much support here at LaSalle University. We want you to be successful. The tutoring is free. Small clinical groups of 1 faculty to 8 students. We have a small class size. We have 1 faculty member to an average of 30 nursing students. Our faculty really get to know the nursing students through the program, and that's really, really a nice feature. We support our D1 athletes, honor students, military service, types of clinical sites. We're very lucky to be in Philadelphia and have a variety of community partners to work with. Our students go to University of Penn, they go to Jefferson, they're at Temple, they're at Einstein Medical Center, they're at Holy Redeemer, they're at Mainline Health, they're at St. Chris, they're at CHOP. That's a few of the many clinical sites. They're over in New Jersey. We are also in the community. Community is an important part of our program. We start sophomore year, where our students take a clinical course in the community, and then they repeat another course in public health senior fall semester. We have interprofessional education programs. It is so important to work with others, to be a team. You can see that now and what we're working on at a national level with the COVID-19 crisis, that it's important to work in teams. So we teach that at LaSalle early on. We are in a school that also houses a nutrition program. We are with public health. We work with communications. We have a business school. We have the social work. We have psychology. So it's really, really important that we work together and we teach our students that early on. Simulation experiences throughout the curriculum. Starting sophomore year, first semester, we will have students in our simulation lab through senior year. And what's really nice about our program is that our offices are housed in the building that your labs are in, your classes are in, and your simulation center. So that's a nice feature. What makes a successful LaSalle nursing student? A strong math and science student. A student really is going to be successful in nursing if you like science and you are strong in math. Critical thinker. Have a solid SAT, ACT score. Be a proactive learner. We are here to help you and support you, and you want to seek out help. You want to ask a lot of questions. You want to work with your peers. You want to work with your academic advisor. You want to be willing to work hard, and we will guide you every step of the way. And the ability to carry 17 credits each semester of freshman year.
As an academic advisor, I will help students sort of show them the tools that they need to reach the top of the mountain. So if you look at a mountain climbing as an analogy here, we are there to support the students. We are there with the ropes and the belayers to help the students reach the top, but the heavy lifting and the heavy climbing will be on the students themselves. So as an academic advisor, I hope to mentor students for their present situations and looking toward the future as well. I want to guide a student's progress toward graduation to see that they are on track to graduate in 4 years, to share information about the university and program policies, and to assist students in finding solutions or providing resources for those situations that may impede a student's progress. As you can see, here is an outline of our 4-year BSN curriculum. In the freshman year, students take non-nursing courses, but these are very important courses because they are the foundation for the nursing courses. And they include college writing, your 4 sciences, chemistry for the life sciences, anatomy and physiology 1 and 2, microbiology, 2 psychology courses, a math course, and a presentation skills course. In sophomore, junior, and senior year, you can see that you'll have a mix of non-nursing courses and nursing courses. And Dr. DiGiacomo is going to talk a little bit more about the nursing courses now.
Thank you, Heather. Yes, it's important to note every course in the curriculum is very important. I'm just going to highlight some of the nursing courses. Sophomore first semester, you will take a health assessment course. That's a 3-credit class. 1 credit is a lab. So every week you will be in our lab over 14 weeks. And that will also complement your intro to nursing practice. And that is working with students in the community. It is your first nursing course. You will also take pathophysiology at this time. And nutrition will also be a great balance too, and build your foundation. And then spring semester, you are in a Foundations of Professional Nursing Practice course, and that is 126 clinical hours. You also will be taking a pharmacology course. Then you'll go home over the summer, and you can apply for a nurse's aide position, a nurse externship position, and that's really great because you have 1 year of clinical experience. Then you come back junior year, first semester, and you will take the Adult Health Nursing 1 course. And that Adult Health Nursing course is the inpatient course over the whole semester. You will also take the Nursing Research and Evidence-Based Practice course. And we are at a variety of hospitals that I already spoke about with the Adult Health Nursing. Then you will come back spring semester and you will take OB, obstetrics, as well as pediatrics over the semester. And currently we have 84 clinical hours devoted to OB and 84 clinical hours devoted to pediatrics. Then you get to go home, and that summer you can also apply for an externship position. And that will build your foundation. So when you come back senior fall semester, that you will be working in psych and public health for the whole semester. We will also start the Senior Seminar 1 synthesis course. That's a 1-credit course, and the focus is preparation for state boards. I will also state that we start teaching you and preparing you for state boards starting sophomore year. So we are reviewing questions because it's all about practice questions too. Spring semester senior year, you're in a nursing leadership and management course, as well as the adult health nursing course. And that adult health nursing course is the entire semester working in clinical 12 hours a week. And then you have your senior seminar synthesis course, and that is your last course to prepare you for the state boards.
This is a sample freshman schedule. It's just an idea of what your schedule would look like on a weekly basis as a freshman nursing major. So you would have maybe a developmental psych course Monday, Wednesday, and Friday morning for about 50 minutes. You would have chemistry lectures and English And then as you can see on opposite days, Tuesdays and Thursdays, this particular student has anatomy and physiology and math, as well as their labs for anatomy and chemistry Tuesday and Thursday morning. So this gives you an idea about how you fill in those credits, how you are taking 17 credits, and how you're then using your time wisely outside of class in order to make sure that you're meeting the GPA requirements that we request. And we'll talk about those in a couple of minutes. But the time that you have in between here, say for example, between this chemistry lecture ending at 10:25 and your English course at 11:45, that's a great time to sit down and review your chemistry notes that you just finished taking while they're still fresh in your head. And then you'll have maybe the whole afternoon on Mondays, Wednesdays, and Fridays for review. You've got time here in the morning before going to class, and then time in between your labs and your afternoon courses for Tuesdays and Thursdays to give you more time to study. Just want to show you a little bit about our freshman honors curriculum. If students choose to do the honors program with the nursing major, their schedule would look a little different than the one I had just showed you. The honor students take a triple interdisciplinary course that is a history, philosophy, and literature course. So that course takes the place of some of the other non-nursing courses and non-science courses that freshmen take. They also take the honors lab, which is basically a field trip every week that students get to do to cultural events around the city that tie into the history and philosophy and literature interdisciplinary course that they take. And then those students would also have the sciences, anatomy and physiology in the fall, and anatomy and physiology 2 in the spring. And then micro and chem would be either fall or spring semester. To progress into the nursing major courses, which begin in the sophomore year, students would need to have 34 prerequisite credits completed, and that's looking at that 17 credits in the fall semester and 17 credits in the spring semester. They must also earn a 3.0 overall GPA, which is the GPA requirement also to retain any scholarships offered at LaSalle. And then students must also have a 3.0 science GPA. And that science GPA is calculated on those 4 lab sciences: anatomy and physiology 1 and 2, microbiology, and chemistry. A C or better in developmental psychology is also required. And we do offer summer courses here at LaSalle, or students have the opportunity to possibly take them closer to home if those are needed in order to meet the credit requirements, or to take the classes here if they need the GPA requirements. And sometimes students find that they are not loving math and science as much as they thought they would. So we want to make sure that students have a plan for an alternate major if they're thinking about maybe that this is not what they were thinking that they would be successful in, that they could look at the other majors. For example, we have a lot of students who think about social work, very close to nursing in its sort of plan of taking care of people, but it also doesn't have the intense science requirements that nursing does.
I had the opportunity to attend an Independence Blue Cross externship presentation, and that was through all the students that applied to these programs. And I was very impressed with our nursing students that presented. I can't share all of their students, but I did want to highlight 1 or 2. This is Nikki Vicky, and she had the opportunity last summer to work in the community, and she spoke about combating the Philadelphia opioid epidemic via harm reduction for homeless adults. Nikki was a sophomore going into junior year, and that's what she presented over the summer. So that was a great opportunity for her just after 1 year in a nursing program. We also, Nikki, she applied to present her evidence-based practice poster that I just shared with you at Children's Hospital, and it was accepted. That was very exciting. Also in this picture, you will see 2 of our faculty that coordinated a program at SHOP that they were able to take students over for the evidence-based practice presentations. So and they teach the evidence-based practice course. So that was really nice for them to see that. This is one of our senior nursing students, Adana, and she spent 2 summers in the Independence Blue Cross. And what she chose to speak about this past year was mental health for women in the Philadelphia region. Adana also went to Rome with a group of clinical students in their pediatric rotation, and that was with Dr. Fran Kinder, who coordinated that through our LaSalle University. And we would like to offer that again. It's an option for us. We just want to make sure that our students that are interested, that we prepare them, that they have that opportunity if they want. And that would be the spring semester junior year. One thing I highly recommend is that students be involved and engaged in clubs at the university. And one of our clubs is called the Student Nurse Association in Pennsylvania. And it really is a great club to get to know each other at different levels. You have the opportunity to attend a state conference and also work with other club leaders at LaSalle, promoting community service and also professional networking, which is really important.
These are some of the events that SNAP has taken part in throughout LaSalle, around the community and things like that. So they work in blood drives. They do career building and resume reviews with our Office of Career, our Career Center office, as well as a community health fair. And they also help with our open houses. And they do a lot of other things around the community as well. These are some of the more active student groups on campus, one of the more active student groups on campus.
This is Colby Kennedy. She's the president of SNAP. She's a junior and has shown very good leadership skills. And we also wanted her to share why she chose LaSalle. And why she chose LaSalle is the clinical site locations, start clinical sophomore year, abundant amount of resources, tutoring sessions, extra lab practice hours, meeting with professors, and high-tech simulation lab, and a caring nursing staff. Since starting school here, I have made some of my closest friends join SNAP, and I'm learning the necessary skills to become the best nurse. I also want to share that we have tutoring throughout the program, starting freshman year, and then this year, our dean supported us starting a peer academic tutoring within our nursing program. So this year we have peer academic tutors both in pharmacology and pathophysiology. And they've received a lot of positive feedback about the peer academic tutoring within our own program. I also want to share with you, we have a full-time tutor remediation specialist, Sharon Mingo, and she works with our nursing students starting sophomore year throughout senior year. And one of our spring graduates shared this with me, and I wanted to share this with all of you. I would like to say thank you again so much for keeping me sane through the NCLEX process. I truly could not have done this without you. You have no idea how much of a positive impact you made on me, along with all my friends and classmates who attended or still are attending your study support sessions. You have never lost faith and kept us all determined, preparing us to succeed. I had my first day at Thomas Jefferson University Hospital today, and I couldn't help but think about how I'm officially a registered nurse because of your confidence in me. I hope LaSalle understands how helpful your support sessions are, and I will contact whoever I need to make sure they give you the credit you deserve. And one of our graduates. And again, we want to support you. Sharon does work with a lot of our students, and nursing faculty refer students to Sharon as needed, as well as the academic team. First-time NCLEX RN pass rates. Last year was 93.51%. I guess I can say 94%. And the average here in Pennsylvania was 91.61, and the national testing average was 88.07. So we have a very good success rate for our first-time NCLEX pass rate. So that's very good. We also have the Nursing Honor Society and Kappa Delta chapter of Sigma, and that's an important piece to also consider. 30% of our students who are seniors are admitted to the Nursing Honor Society and get to work with our faculty at the end of senior year, and it's a great opportunity and networking for the future. We did mention to you that the student nurses coordinate the career fair, and that's also done with our career department. It does an excellent job. And we had a really successful health fair and career fair this year. And the career fair, one of the teams that came was from Children's Hospital, a recruiter right on site. We also had Einstein. They were with us, and a lot of other members. I just can't share all the pictures. So getting involved in continuing education. I still remember when I went to nursing school, when the dean spoke to us, they said, welcome to this nursing program. This is just the beginning of a lifelong learning opportunity. And I didn't really think about it before then, but your BSN is a start of a lifelong education. We have a lot of different programs in the master's here. You can get a master's of science in nursing. We have the adult gerontology primary care nurse practitioner program, the family nurse practitioner program, and we are just starting the psychiatric nurse practitioner program, and the first cohort will begin this fall. We have nursing certificate programs. We have a DMP nursing practice program, and we have a nurse anesthesiology DMP program. I do want to just share that there is additional student costs when you're in the nursing program. You know, we have books and online resources that there is a cost. Castle Branch Compliance Program. We will go over this with the students freshman spring semester, so they become, comfortable in this program. Part of the Castle Branch compliance, and those of you who are in healthcare know that this is a requirement, and it's the clinical sites that require this. FBI, criminal background check, child abuse screenings, an annual drug screen. You will need to be CPR certified through the American Heart. Student uniforms, there's a stethoscope and a nursing kit. And then also the student transportation to clinical sites is an added cost.
For students who were admitted to the university as an undeclared health science major, those students still have the opportunity to move into the nursing program and graduate in 4 years. I will let you know that a summer semester or more is required, so that instead of taking 2 sciences in the fall semester of freshman year, students who are admitted as undeclared health science majors take 1 science, and we move that second science, either the microbiology or the chemistry, to the summer between freshman and sophomore year. So students would be required to do that. There are also slightly different progression requirements for students admitted as undeclared health science majors, and that would be outlined in your admission letter from the university. Students are also required as UHS majors to take the TEAS exam, which is the Test of Essential Academic Skills. And that exam is administered during their freshman year. They have 2 opportunities to take that exam, and a minimum score will be required on that exam in order to progress. And as we mentioned, if you are looking for your acceptance letter, it will have all of the information that you need in order to progress as an undeclared health science major into the nursing program. There are 2 student success coaches, Carla and Jose, who are currently working with all of our undeclared health science majors to help them progress into the nursing major or find other options available to them if they are determined that nursing is not what they want to do.
We want to thank you for attending this virtual session. If you have any questions, you can contact the admissions office. You can contact me. My phone number is here, and also my email. Thank you very much for attending, and stay healthy.
Thank you, everyone.